This is a recording to talk through how to access the Chemocare system and how to verify clinical prescriptions. So if you access Chemocare via the quick links or via the intranet, go to C for chemotherapy and there's a Chemocare link there. If you log on using your unique username and password, which will have been allocated to you when you are set up on the system, change the domain to external and use your swivel pin to log on. The top numbers always stay the same and the bottom numbers vary, so you need to make sure that you're using this correctly in order to log on successfully. Click onto the Chemocare live link. This will take a few seconds to load up, and this will be the process where you're actually logging into Chemocare now. Again, your username should be populated, and if you use your password again, go to the chemo list and you should be able to see patients who are due for treatment. You can see here that this is selected for Hexam patients, and if we look for the 23rd, if you right click on the patient, highlight them and select their treatment summary, you go into their patient record. You can see here there are treatment notes on the system. These provides clinical information that you may need, and you can see that the patient's planned for some treatment. So if you double click and open the script, you can see all of the prescribed treatment and the planned doses. You can see the day of treatment and all of the supported medications as well. If you go to print prescription and preview, you can see that there are some blood results that are needed. There is also some more administration notes, and you can see the information on the script in a little bit more detail. For example, the number of milligrams per metre squared and the fluids that are being used to infuse the treatment. And again, you can see all of the drugs on the script that are needed. And if you click the X in the corner, this will then load up the supportive medication and oral script, and this will contain all of the medication the patient needs to go home, so antiemetics, dexamethasone. If you move forward, you can see that there's also some loperamide there to support the patient through their treatment. You can see at the bottom of the script that there are allocated by and confirmed by signatures, and so this means that this is a signed prescription and we're fine to verify it as long as all the treatment makes sense. So if you go into the laboratory tab at the top of the screen, you can see the blood results that are pulled through from the isopathology system, and there's also biochemistry results there. The next tab, tumour markers, contains limited information, but it does have adjusted calcium, which we do use in some of our protocols for verification. If you go back to the treatment summary screen, you can open the modification history, and you can see that if there's been any changes to the script, for example, the cycle numbers have been renumbered here, and it helps you track back through any adjustments and amendments. And you can also see when it was confirmed for the first time. If you exit that and go back to the chemo list, we're going to verify the prescription now. So on the chemo list, if you double click the date and find the date that you're interested in, using the calendar function, click, and if you type in your password and click check, this then adds a verification signature, and that script is now confirmed by a pharmacist as well. And you can see that there's a cross in this C column. So that means that the pharmacy production unit can prepare the treatment for the patient. If we now go to print prescription and preview, you can see that there's a signature in the bottom right hand corner where it's been checked by a pharmacist. The authorization stage is the nurse's stage when they authorize a treatment to be given based on blood results and patient assessment, and once they've done that, all 4 signatures at the bottom of the screen will be complete. If you go back to the chemo list, you can then exit and exit Chemocare using the appropriate button.